back off, and you're going to pull that up. And what you're going to find is just do some diagnostic passes to find the area where the most grit is, and I'm finding that right there. Now I'll landmark, and I have one of the spinuses, the other one there. I know I'm going to be in through there, so I'm going to hold tight. I'm going to be able to sink in, and I'm going to pull up and come out just like that. I'm going to sink in, pull up just like that. And then each time you might want to get a little more motion because that's going to start to open up. Sink in and pull. Get about 5 to 7, maybe 8 or 9 in this area because it can take more. And then move up to the next one. And the really good part about the instrument treatment is once it's had enough, it starts to get red. You don't want to push it any further than that. A lot of people go too hard and it actually creates too much inflammation. So you want to have enough just to get a red feeling in there. And essentially that's the body's way of saying it has enough. You always want to do less is always better than more because you can't go back from that. So we find some redness and then we know to leave it alone and let it chill out.